Hi everyone, I am Dr. Karthika Krishna Kumar, Consultant Endodontist and Director at Metier Multispeciality Dental and Polyclinic, located at Vidyaranyapura, Bengaluru. Achieving and maintaining good oral health takes a lifetime of care. Even if you have been told that you have a good oral health as well as your teeth are nice, it is crucial to take the right step every day to take care of your oral health and use certain routine measures to prevent problems. This involves getting the right oral care product as well as being mindful of your daily habits and practices of oral hygiene. So, on the occasion of World Oral Health Day, that is 20th March, I would like to brief you about certain routine measures to maintain a good oral health. Some of them are: don't go to bed without brushing your teeth, as it is always recommended to brush at least twice daily. Brushing before going to bed will remove all the germs and the plaque which is accumulated throughout the day, in turn helping you to have a good oral hygiene as well as your good gum health. Brushing properly along with brushing twice makes a lot of difference. The way you brush is equally important. In fact, doing a poor job of brushing your teeth is almost as bad as not brushing your teeth. So take your time moving the brush with a gentle circular motions of strokes which help in removal of plaque maxima. Unremoved plaque can get hardened and form calculus, which can in turn cause gingivitis and cause early gum disease. Next, do not neglect your tongue while brushing your teeth. Even your tongue can accumulate plaque and cause oral hygiene issues, and also can lead to bad breath if the plaque is not removed. So brush your tongue equally as well as you brush your teeth and gums. Use of fluoridated toothpaste. When it comes to toothpaste, the ADA recommendation is to use a toothpaste which contains fluoride. Being a naturally occurring element, it is proved to be a defense mechanism against tooth decay. It can help the tooth enamel to be strengthened and also can reverse initial cases of dental caries. Then use of flossing is also equally important as brushing. The floss is not just for removing any food particles which is stuck between your teeth. It also stimulates the gum condition and by maintaining it healthier while removing the plaque and unwanted calculus of food debris. Use of certain mouthwashes which can also help in maintaining oral hygiene. Do consult your dentist to seek certain recommendations for mouthwashes, as certain mouthwash are good for children and certain mouthwashes are best for sensitivity. Then you avoid eating sugary diets and acidic food. Drink lot of water, as water is good for your overall health. It also helps in improvement of your oral health. It helps you to prevent your dry mouth and helps in keeping the oral hygiene well. Then you avoid smoking and other tobacco products, and use of certain crunchy and fiber content foods which will help in maintaining your gum conditions by giving a massage kind of feeling to your gums. Then at last, always try to see a dentist once in a year and get a regular checkup done, through which the dentist can assess your condition and give you certain advices or help you in preventing further damage to your condition by giving certain treatments. Thank you.